Hey everybody, thanks for watching. Maggie Yu, MD, functional and holistic medicine physician and owner of Transform Autoimmune Disease Naturally. If you haven't joined the Facebook group, go ahead and click and join the Facebook group right now. For those of you that are watching from YouTube, make sure you click subscribe and make sure you click the bell so you get notified whenever a new video appears. Today I really want to talk about the role of medication and medication changes or adding medications right now for those with autoimmunity and why that presents specific challenges in the times that we're dealing with right now with the pandemic. I wanted to, for those of you that are alumni, please comment below how you're doing, how you're coping with what's going on right now in the infection space and with the pandemic. Those of you that are currently in the program, say hi and let everyone know you're in the program in the comment section below. First of all, medication change. What we're hearing from a lot of people reaching out to us on the phones right now is really critical because right now what's going on is people with autoimmunity are facing a threat where they're having decreased or no access to their current providers. Number one. Number two is they don't want to get out of their house. And I understand, I don't want to get out of my house either. And a lot of, right now, social distancing and stay-at-home orders, we can't get out of the house. So access is really limited. Number two is that some people are on medications that suppress your immune system, immunosuppressants, or biologics that play around with your immune system. And all of these can put you at increased risk of getting an infection. And then there's a group of people who are being told right now that they should get started on a medication for their autoimmune disease. And is this the right time to actually be starting a medication or making some major shifts in what their medication regimes are? And then there's a fourth group, people who says, I want to get off all my medications right now while I'm dealing with autoimmunity. And I think it's important to address all these particular cases. If you fall into one of those categories, just tell me what's going on in the comment section below, and I'll be sure to make sure that I address these issues. So number one is that access to providers. I want to point out that our program, Transform Autoimmune, I've been in practice 24 years. Our online program has been for 3 years. And it's 100% online, done from the safety of your own home with educational modules, live coaching sessions that are in small group, as well as testing that's shipped out to your home directly, all in an online program that we've been doing for years. So we're years ahead of the curve in delivering an online program successfully turn around autoimmunity. And if you want to see case studies of people who've gone through this, we have almost 100 right now. And those videos are all on our Facebook page, Dr. Maggie Yu, or in our Facebook group. So join in and see it, okay? Because this whole idea of delivering something to the safety of someone's home is not new. It's just right now that particular solution is really apt for people dealing with access issues. So I want to dispel almost that myth number one, which is like, I don't have access to my current medical providers and therefore I'm screwed. That's not true. And I want to point out that there is online access that's available, and we've been doing this for years. The other thing is that my question for you with dealing with autoimmunity is, what was the access getting you anyway? Because the limits of the conventional doctors and regular medical doctors is that they only have medication or surgery procedures to actually help with autoimmunity. Right now, do you think medications or procedures or surgeries, do you think those are actually going to help with your autoimmunity? Have they up to this point, and do you think they will help now? And do you even want to bother getting any of those right now? And if the answer is no to any of those questions, then I'm going to tell you the conventional medical approach has failed your autoimmunity, and it's just more obvious right now than ever because you don't have access, you have less access to getting the medication, less access to the procedures, but you get to evaluate and pause right now. So did they even work in the first place? This is where functional medicine, myself, a functional holistic medicine MD, really comes in, and this is where it shines, because functional medicine really looks at what's triggering the autoimmunity. What are things you can identify and fix now to decrease the chance of getting into a flare or dealing with your current flare? Isn't that the objective that you want right now anyway? So for me, thinking about this from a different perspective, where you're thinking, okay, my biggest threat right now isn't even COVID or getting an infection, right? My biggest threat right now is actually my current flare sending me to urgent care or the doctor's office or the hospital, or preventing an upcoming flare that's going to happen, that's going to land me in the hospital. So when you think about that as a perspective, the most important thing you can do right now in the safety of your own home is think of ways to deal and prevent a flare. And what has worked in the past? What didn't work in the past? When you critically evaluate that, you're going to see that medication and procedures and surgeries are very limited. So this brings me to the point of this is the time more than ever to think about naturally figuring out what the causes are. If you haven't seen my online training where I talk about the pillars of our program, you really want to start thinking about major areas like hormones. Hormones are really triggering this. So if your hormones are imbalanced, don't you need testing? And don't you need to understand what those patterns even mean? Food, don't you need science to actually train you on what food is actually triggering your autoimmune attack? Vitamins and nutrients, don't you need to understand testing with functional values, not just what the lab or your doctor tells you are values, to show what deficiencies you have that's impacting upon your immunity now? Don't you want to work on your gut? And think about blood sugar. Sugar is feeding infection. In fact, diabetes and blood sugar imbalances is one of the biggest trigger associated with the upper respiratory infections that we're dealing with right now. That's the biggest risk factor that we're seeing. So what I want to point out is that this is time more than ever to think about root causes rather than medication or more procedures. So that's a big group that I want to say is that medicines are not here to rescue you at this point. Right now, it can put some people at even greater risk, and it's more poignant than ever to look at root causes. Now, another group that we're talking about is people with immunosuppressants. Medications like prednisone, methotrexate, some of these medications that really actually can suppress your immune system right now. Some of these biologic medications, Humira, a lot of these medications in these groups, what you're seeing is that they actually shut off all or part of your immune system. And this is a very tricky question to navigate, because if you are on a medication that is turning off your immune system, and yet right now a huge threat is infection, and the number one side effect of that medication is life-threatening infections, what is going on right now is you're essentially at a very high risk level and a sitting duck. So the reaction most people have to this is severalfold. Some people say, I'm going to get off all these medications. Well, what's going to happen when you get into your next flare and you end up in the hospital going to the hotbed of infection? Is that a good solution? Okay. Some people are like, my doctor has told me to make changes in my medication. Well, every time you change your medication, I'm not saying it's good or bad, but there is a risk that you could be risking a flare, because it is kind of a let's see what happens. So is changing your medication right now the best idea? Or no? Does it put you at higher risk? And when you think about these things, and some people have been told, oh, I have autoimmune disease, I just got diagnosed, or right now is the best time, you should start on a medication right now. Really? Should you start on a medication right now when there's a risk of side effects or an adverse reaction to the drug at a time that can land you in urgent care or hospital? So these are really real discussions that you really need to be having with good advice. And the problem is that the advice they're getting is from doctors who are dispensing these medications with very poor knowledge and tools of how to actually fix the root causes. So for me, people in our program working with us, this is why they need us, is that I'm able to look at, hey, here's your own data, here's some educational modules, here's weekly access to our team, including me and a nutritionist and others that are expert in autoimmunity. And let's go through specifically what's the best scenario for you and your health right now. People need to be supported in these decisions to make what's the best choice given what the current threat is, that's timely and empowering to give them additional choices to do besides just adjusting these medications. Or if they have to adjust these medications, what are the other things they're going to do anyway to prepare for that adjustment or the fallout from it? So I want you guys to really, this video is really, there's a lot of complexity to it, but I'm raising some questions that all of you should be having when you're thinking about stopping a medication, adjusting a medication, or starting a medication. These decisions cannot be made in a vacuum without thinking about, what's your plan then instead? Or what's your plan in case there's fallout from that decision? And who's the expert that's going to guide you in that? Do you have access? And is your doctor the expert that's going to be able to guide you on all the other tools that you have besides that medication change? Right? If those are the questions that I think people should be really asking, and I think that it is not simple at all. And that's why I'm really proud and glad of the fact that we have a program that supports people being able to do this entirely online from the safety of their own home. So if you want to work with us, go ahead and click the link to book a call with us so we can learn more about you, to see if and how we can help you with your autoimmunity and decreasing your current flare, getting rid of your current flare and decreasing any future flares, and preventing or treatment of any infection that's coming your way. So I hope that was helpful. And if you did found it helpful, go ahead and make sure to share this video with anyone with autoimmunity that you think this could help. Thanks.
Lupus, lung fibrosis,
Hashimoto's thyroiditis,
fibromyalgia, AS, which is a form of arthritis,
Epstein-Barr,
extremely fatigued.
pretty much zero joint pain.
Much more happy.
I don't have brain fog anymore.
how much weight I have lost.
I want to see remission.
Maggie and her approach is very different than the traditional doctor.
I'm a totally different person.
I got a better understanding of what those intolerances were.
You're not alone.
The community is, I'm learning from everyone else's issues.
It's not just helped me, it's helped my entire family.
We are transformed.
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 Join the movement and transform your autoimmune naturally today.